what is Medicare and Medicaid? How does it work? And whom does it affect the most? It's a loaded question to ask you in a short version, but I find a lot of people are confused about Medicaid, Medicaid care. So let's talk about the history. What is Medicare and Medicaid? As an opening question, what are they?
I know that many Americans are confused about the difference, and sometimes politicians are confused too, and they give entire speeches where they need to talk about one and not the other. So I will try and explain it in a way that if I was talking to you, Dan, or your listeners at a party, not so wonky. So Medicare and Medicaid are both about 50 years old. They were passed under President Lyndon Johnson as part of the Great Society program, and it was a major expansion of who could get health insurance coverage. And one way that I've learned how to remember it, Medicare is care for the elderly. If you are over the age of 65, you are entitled to get Medicare under the current rules. So it's an entitlement program for older Americans. And then there are some disabled Americans and a few other folks who get access to Medicare too. But for the most part, it's for older Americans. Medicaid is aid to the poor, the vulnerable. It is skewing much younger than Medicare, and states have a lot of control over how much they want to expand Medicaid, cut it back. And in the past couple of years, we have seen many states expand their Medicaid programs because of the Affordable Care Act. It gave money to states to make it more worth their while. Right now, 75 million Americans are covered by Medicaid, and that is at issue because the Republican bill takes straight aim at the Medicaid program and wants to cut back funding for it.